with a 1 professional development credit for SHRM CP or SCP. I'm Kara Tarantino, the Vice President of Marketing with Orthus Health, and I'm thrilled to be presenting today with Chris Perry, our Director of Clinical Services, who has vast clinical nursing and population health management experience. First, a little background information on Orthus Health. At Orthus Health, we focus on minimizing the life consequences and costs of chronic disease. We have a scientifically proven predictive model that accurately shows individuals their risk for 6 chronic conditions and gives them a highly visual pathway to change. We demonstrate to employers the costs they can avoid when employees modify their health risks. Our platform enables employers to go beyond wellness with personalized health management services, digital tools and technology, and enterprise analytics, offering fascinating prospective and retrospective views on your data. In addition, our model enables employers to see if the programs they already have in place are working and worth their investment. In a nutshell, everything you need to manage employee health, disease risk, and costs in one place. The foundation of Orthus Health platform is deeply rooted in science with a fascinating historical perspective I'd like to share with you briefly. In 1945, President FDR died of heart failure and stroke after a prolonged illness of uncontrolled hypertension. Following Roosevelt's death, the National Heart Act became law, granting funds for the Framingham Heart Study, which focused on risk factors for congestive heart failure and a better understanding of prevention. Then in 1983, and in rural China, the China-Cornell-Oxford study was born. The study uncovered even more risk factors for disease, such as the relationship between nutrition and disease. The higher the diet in plant-based foods, the lower the risk of disease. These highly regarded studies gave rise to a new disease prediction model and risk tracker called Know Your Number, which eventually outperformed the original Framingham risk score, giving us a superior way of predicting risk, onset, and progression of chronic disease and associated costs. We'll discuss some of these highlights and the impact on the health of your population later on. Today, we will focus on some creative population health management strategies to help you engage your workforce, how you can lead employees to healthy behaviors that can improve outcomes simply by pinpointing health risks and giving employees the opportunities, knowledge, and resources to be accountable for their own health. We will talk about why high tech is far more useful when combined with high touch, and how to get senior level buy-in and support you need to be successful. With that, I will turn the presentation over to Chris, who will dive into the mechanics and highlights of population health. Following, I will take you through some practical and actionable applications so you can immediately begin to engage employees more effectively using these easy to implement population health management strategies. So Chris, you're on.
Thank you, Kara, and thank you to everyone who's joining us today on the webinar. As Kara said, my name is Chris Perry, and I am the Director of Clinical Services for Orthus Health. I have had the pleasure of working in healthcare my entire career. A little bit about my background before we get started. I like to say that I've done everything within a hospital from CNA to CNO. I've also worked in the medical device industry, population health, and association management. It's my honor to be speaking to you today. I really hope you find the information that we're about to share thought-provoking and interesting. Now let's dive into the presentation. Population health management is a complex and sometimes vague concept. That is evidenced by the variety of search results that will be returned on a Google search for the term population health management. Let's talk about that in relation to population health management and truly what it is. Population health management is the application of management strategies to improve the delivery of healthcare for populations with an emphasis on achieving the highest quality of care at the lowest cost. Now, briefly, let's break down populations a bit. Populations can range from a national population to a state population to a county population, all the way down to an employer population, and that's where we're mainly going to focus today. Population health management overall has a triple aim. The triple aim was developed by the Institute for Healthcare Improvement, or IHI. The triple aim is a framework for optimizing health by improving the patient experience, improving the health of populations, and reducing costs per capita. As we move through the presentation, I want you to think about your populations, your workforce, and your community. Population health management has a set of core measures. Many of us are familiar with core measures already. Core measures were developed by the IOM Institute of Medicine back in 2015. I'm going to name just a few of them for you today so you can start thinking about these different core measures as it relates to population health management. Life expectancy, well-being, overweight and obesity, addictive behavior, healthy communities, preventative services, personal spending burden, population spending burden, individual engagement, and community engagement. These core measures were developed to have a systemic reach and be outcomes oriented, which we'll discuss a little more in depth later. We want this to be at a personal level, so not just for the population, but for the person. There are several population health management approaches, and I want to just touch on two of them briefly today. The two approaches I want to call out are hot spotting and cold spotting. Hot spotting is a population health management approach that involves identifying population groups with particular areas of need and developing interventions to address those specific needs. Cold spotting is a population health management approach that involves identifying population groups who lack access to health care and other community supports that influence health. When thinking about hotspotting, one real-life example that has faced me comes to mind. Years ago, I served as a chief nursing officer for a hospital in a rural area of the country. I won't name the state to be respectful here. The workforce in that county was primarily based in manufacturing. With this came certain areas of need, primarily being overweight and obesity without a solid education on healthy eating. Thinking about cold spotting, another real-life example comes to mind. While serving as a hospital executive in an area of the country that was very rural and again lacked education, but more importantly, they lacked access to primary care, and that was a major challenge for everyone. The community would use the hospital emergency department as their primary care provider. We all know the issues that this causes when it happens. The ER faced a constant backlog. Emergency care, even at baseline, as you know, is extremely costly. And by the time that someone reached us, they were already sick. There was no prevention, no education, no wellness education, and no care that would have prevented them from resulting in going to the ER that day. All of this resulted in very high claims from the employer, whose employees went to the emergency department as primary care. This then places a burden on the insurer. All of this rolls back to the employer with higher rates for health insurance year after year, cutting into margins greatly. With increased premiums, employees are less likely to sign up for appropriate health insurance, and the cycle continues on and on and on. The domino effect here is very easy to see. This is negatively impactful to all. Overcoming these challenges typically requires the education, engagement, and interaction of key stakeholders. Senior leaders must understand that an employer can do everything right to influence the health and productivity of its workforce. But if the same workforce lives in an unhealthy community without education and without wellness care, employer investments can be compromised. Population health management with wellness programs that lead to improved health have identified great business benefits that include attracting and retaining talent, more engaged employees, greater performance, improved personal safety, sustainability, and improved brand reputation. Employee engagement is key. Educating and empowering employees with the right tools will lead to success for the employee and success for the employer. Combining the right resources in a way that is meaningful to your employees will let them take charge of their health. Combining the right resources such as data, programs, and tools will truly give the employee the necessary resources to succeed to meet their individual health goals. Emphasizing healthy behaviors on an ongoing basis through education, healthy competitions in the workplace, and results-oriented programs will slowly change unhealthy behaviors to desirable behaviors, such as eating right and exercising more. When an employee completes a health risk assessment with biometric data, their eyes are open to their own health status. The health risk assessment can give accurate information on where an employee needs to focus their health goals. Being able to trend this year over year can demonstrate the employee's commitment to improving their own health. When the employee has an opportunity to review this assessment with a health coach, the education and action process begins to improve health. Many employees do not think about improving their health while at work. Expert health coaches can discuss activities such as low-impact exercises at your desk, incorporating yoga into your daily work routine, just getting up from your desk and walking around each hour. These changes can not only improve healthy behaviors, but lead to more engaged and more well-balanced employees. These healthy habits can be reinforced through health coaching programs to keep that employee on track and motivated to dedicate themselves to changing their lifestyle and improving their health. It is imperative to get senior level buy-in to implement a successful wellness program. This frequently requires the education, engagement, and interaction of key stakeholders with a goal of a commitment to process improvement. Committed senior leaders have a desire to improve the health of their employees for many reasons, most importantly to them, a return on investment by improving the wellness of their population, their employees. Think of the senior leaders that you interact with on a daily basis and think about how they might view proactive wellness. Evidence-based data is the key. Nationally vetted scientific wellness data applied to biometrics and identifying an individual's views on wellness, along with their readiness to change adverse behaviors, is the catalyst for successful population health management and wellness programs. Think of the geographic variation seen in health outcomes within the United States. Mortality and morbidity vary greatly, and this is often due to three major factors, any of which can lead to an adverse health outcome. Social and economic factors, clinical care, and most importantly, health behaviors. Social and economic factors can be the level of education of the individual, the type of employment, income, family and social support, and community safety. Clinical factors include access to care and the quality of care that's provided. Again, the major influencer of health outcomes is health behaviors. I want to name a few of these health behaviors that are modifiable: tobacco use, diet, exercise, and alcohol use. all of which are modifiable by the individual to improve their health. The combination of prospective and retrospective data will give employers powerful data analytics on the current state of their workforce. Each workforce is a unique population. Combining the right scientific resources such as predictive data modeling with a wellness program can lead to improved outcomes, improved health, and lower costs for employers, leaving them with a strong return on investment. In today's digital age, high-tech health risk assessments and health platforms can empower employees to change modifiable behaviors and be more informed of their current health status, trend their wellness and biometrics data over time. All of this can lead to improved health for the employee population. Combining these high-tech assessment tools and platforms with high-touch coaching programs can truly provide the most impact. High-tech solutions and high-touch solutions, such as health coaching, leave the employee with the data, motivation, and education that they need to change modifiable health behaviors. As a comprehensive wellness solution, digital tools, data, and platforms combined with high-touch health coaching is what we consider the secret sauce. Let's talk about health coaching and what it is briefly, and how invaluable this high-touch service can be to keep your employees on track and provide the necessary motivation and education tools to reduce disease risk. Health coaching is an effort to engage people to modify their behaviors and address their own health risk. Health coaches are truly invaluable resources for this. In today's world, employees can engage with their health coaches via mobile app, phone, in person, and via email. As part of a wellness program that drives population health management towards lower disease risk and healthcare costs, health coaches are the key. Health coaching focuses not only on assisting high-risk individuals with improving their health, but also moderate-risk individuals to lower their risk. And finally, those who are healthy to remain healthy. Health coaching, with its proactive approach, assists employees before they become, and I'm doing air quotes here, a claim. In contrast to programs that focus on managing a specific disease or condition, a whole person model of health coaching addresses all of an individual's health risk factors. Health coaching can be short-term, long-term, to every period in between, and tailored to the individual's specific need. Health coaching can have different aims and be tailored to that of the individual. Coaching can revolve around incorporating new health habits into their routine, to exercise coaching, disease management coaching, and coaching to track their wellness progress. The expert knowledge of the health coach is imperative and invaluable to the employee. Focusing on strategy with no gimmicks while providing the employee with the tools necessary to take control of their health, weight, disease process will lead to a long-term improvement of health for the population. This is done by lowering costs, improving the return on investment, and having a more healthy workforce. A whole person coaching approach guides each participant to focus first on the things that he or she is ready to change. These are rather than comply with a set of behaviors he or she is not contemplating. Focusing on individuals' readiness is very important. To meet wellness plan goals, the health coach will help the participant find their own motivation, break through barriers, cultivate the support they need, and encourage employees to maintain their progress for which they've achieved. To wrap up my portion of the presentation, I hope you can see that population health management and wellness programs can assist individuals to an improved level of health and leave the employer with a strong return on investment and a happy and healthier workforce. Kara, back to you.
Great. Thank you, Chris. Now it's time to take Chris's valuable information about population health and put it to use in elevating employee engagement. We understand each of you attending today will approach these strategies from your different perspectives as far as your job function and company are concerned. Please also take a moment to consider these strategies from the other roles each of us has, such as an employee who wants to make lifestyle changes or feel more engaged at work, a healthcare consumer, a patient, or a caregiver. Being able to approach these strategies from these different perspectives and the roles we all have is what will enable us to individually and collectively take action and get results. Today we're going to discuss a little bit more on these 5 important strategies, focusing on healthy behaviors for healthy outcomes, combining the right resources to go beyond wellness, using both prospective and retrospective data analysis, finding a sustainable, no gimmicks weight loss solution, and being able to line up reliable long-term support for employees. So Chris mentioned a number of factors that contribute to health outcomes, and today we'll center our discussion on health behaviors, what can be changed, what employees can be accountable for, and most importantly, how those changes or lack of making necessary change can impact a person's health and risk for disease. And for all of us here, how these changes can impact our bottom lines. We all know there are modifiable habits that we can and should change, and those we can't. What we don't know but need to find out is how each of these habits contributes to our own unique risk for chronic disease and what that pathway to change looks like in order to avoid chronic disease. As you can see by this slide, it's important we give employees the knowledge they need about how their modifiable habits contribute to the conditions that give rise to the overwhelming cost of chronic illness. It is this pathway that we're going to dive into shortly. This slide also is further support of where we need to focus much of our time and energy. The costs of an individual with a precondition are much less than one with a disease, and preventing risk movers is something we can do individually and collectively, armed with the right data and access to preventive services and programs. I'll also add here that it's important for us to look at halting the progression of disease as well in those cases where people already have certain conditions. Wellness and well-being programs are important to engaging employees, but whether or not they are working for individuals and or worth your time and investment is a whole other matter. That may sound strange coming from a wellness provider, but what we are really seeking is to go beyond wellness, to transcend just offering programs for the sake of having them by combining the right solutions with the right resources. Data-driven programs are more effective than those that aren't, and we want to take that fact a step further. Enterprise analytics is key because it provides both prospective forward and retrospective past, or what we currently have, views on data. It enables us to not only have a current snapshot of health and disease risk, but take ongoing looks at the data via claims analysis. Now we can short it, sort it, chunk it, understand it, make recommendations, and then act upon it. Digital tools are a hot commodity now, but they are used more effectively when members know their numbers, have the ability to look in one place and see their current risk score and history. Digital tools are used more widely when people understand the importance of tracking and monitoring their numbers and what changes in their numbers even mean. They need to be able to do this in real time and over time. Going beyond wellness also means looking at targeted health management programs and services, and being able to offer individuals a combination of the right programs based on risk at the same time. As we know, weight impacts a number of conditions, and an individual may be on a pre-diabetic intervention or diabetes management program at the same time as a weight loss program. Does your current solution offer you that option? Going beyond wellness also enables employers to not only look at disease prevention, but to also focus on assessments, data, and support that can lead to developing a full health risk profile, one that includes chronic disease risk along with safety risk. Coaching can transcend what we consider typical lifestyle coaching today to consider job function, environment, collaborative work groups, and relationships to offer even more effective support. Wellness and safety in some organizations are still siloed, but that's beginning to change, especially in face of rising musculoskeletal claims, which are 50% of all claims today, number 3 in the top claims cost category, and it pains me to say 70% of those claims are preventable. So let's dive a little deeper into why you should consider both prospective and retrospective data analysis as one of your key population health management strategies. It's like looking at a flat map on a wall versus a globe when planning a trip. Your perspective changes significantly even though you are looking at the map. The depth and breadth of knowledge and understanding changes when you can see past, present, and future data. It is this fluid worldly analysis that will help you plan for more effective interventions that will prove to be more engaging to employees. And let's not forget about gaps in care. If all we did was focus on age, gender preventive screenings, and centered our culture and communications and investment along those lines, we would see big cost savings and even save some lives. Data is only effective when it is used, and using data is a people strategy. The path to better engagement and lower costs is straight and direct with the right relevant data as your starting point. So what do employees want and need to feel more engaged with regards to their health? They need to know their disease risk score. They need to know their past and current risk score history and all the numbers that go into their personalized score. They need to know what they can change that will cause a change in their risk score. They also need to see in black and white how responsive the small incremental changes they make in their health can change their risk score. In other words, their disease risk score needs to be highly responsive to impact their engagement in any activities and programs. Everyone also needs their own personalized action plan or pathway to change, and that plan is unique to each individual. They need to know how one modifiable risk factor impacts others and their risk for disease. This is powerful information when presented clearly and simply. Employees will say, "You mean if I reduce or change this one risk factor like smoking, it can impact my other risk factors as well as my risk for certain diseases?" The power of the visual representation, their personalized data, cannot be overstated in the ability to affect change. Most employers want control over their financial futures and know population health tools and employee engagement are effective in the wellness programs that they deliver, and that those wellness programs can get them there. As employers, the data can show us our population's health risk, new cases of disease that can be avoided, and the costs that will be avoided in the future as well. And often the tricky part of this whole equation is knowing if the investments we are making in employee health and wellness are paying off. This is what we all want to know, and with the right scientifically proven resources and our ability to use data in the right way, we can clearly see what's working, what isn't, and change our plans accordingly. As this is really quite interesting to see, I've taken a couple of examples from a large employer group to show you the number of new cases of disease that can be avoided. These are also broken out by risk category, as well as ranked above, normal, borderline high, and extremely high. And as you can see, the total number of new avoidable cases that can be avoided are right there in black and white. So how does this translate to costs? Well, this is the real power of the data, is in the cost that can be avoided when these new cases of diseases are avoided. The cost of avoiding disease for the 943 new cases I just showed is over $31 million in this case. This is also broken out by disease and severity of risk. The Know Your Number Disease Risk Tracker is the predictive tool that provides these data calculations and insights. So let's look at some other data that you need to include in this data portfolio. And looking into claims briefly, as this is important for our prospective view and fluid analysis. Do you know where your high-cost claims are coming from? Do you know why those claims are changing and what the correlation is to disease risk and what can be prevented? Claims data tells this unique story about your organization and where your focus currently is and also where it should be. Do your claims reports give you key findings, highlights, and recommendations? If not, they certainly should. We need to make age-gender preventive screenings a top priority. If you look at the value of preventing screenings for colon, prostate, breast, and cervical cancers, for example, you'll see many who just simply aren't getting them done. Then you will see among those, and for example, in this colonoscopy claims report, the number of individuals that had a polyp removed, as well as the number of cancer diagnoses, most likely as a result of the screening. So I ask you, do you know what your claims are for these types of cancers where preventive measures and screenings work? Do you know the trends over time? And are these reports and the data communicating the value of these screenings as a part of your population health management objectives? So another area that demands our laser focus attention these days is weight loss, a serious, committed, sustainable, no gimmicks approach. Employers need to be in the weight loss game long term. We need to look at weight loss as one of the key factors in preventing risk movers. Aside from some of the other obvious benefits, weight loss improves our coping skills. When we improve our coping skills, we become more resilient, are able to build relationships and mend fences better, all of which translates to increased productivity. In addition, of course, the health and disease benefits, disease prevention benefits. Some of this information may not be new to any of us, but I wanted to call out a couple of challenges that we need to address. In this October 31st survey in the Journal of Obesity, it was revealed that only 50% of those who are obese actually see themselves as obese. That in itself is a challenge. Then as we focus on driving our employees to primary care, to increase prevention, reduce ER use, and more, we see that only 28% of healthcare providers even see it as their job to counsel on weight loss. That's a low percentage. So if we are thinking primary care is a catch-all for all the issues that plague employee health today, we really need to think again. Our medical schools don't train physicians to be weight loss counselors. And then, in looking at the last statistic, only 17% of employees even see employer-sponsored plans as helping with weight loss. Together, there's a lot of opportunity here to put sustainable programs in place that actually work. If that isn't enough, obesity coupled with our aging workforce adds up to poor muscular strength that is increasing our workforce's risk for injury and disease. We are seeing reductions in shoulder and knee strength, and even many back issues we are seeing today are actually shoulder injuries. The difference between an individual with a strong strength to BMI ratio versus a weak one is significant in cost. So our buddy Joe here is healthy but obese. Even with his normal blood pressure and normal cholesterol levels, his cost to society is $36,000. His struggle affects everyone and impacts all of our health claims and health insurance premiums. So Joe's engagement with his health impacts your success as an employer. He needs to be accountable for his own health, but he can only do that with the right relevant data that he understands that includes a clear pathway to change with an action plan. We want to be visually articulate with his biometric risk factors, his overall risk for disease, his modifiable risk, and also his risk compared to his peers of the same age and gender. That is when the reality really sets in. Seeing how his risk stacks up to his peers is usually an eye-opener for most. So what's needed for effective weight loss? Tools, equipment, program materials, and the right support, to name a few. But we don't want to just throw these at individuals. We want to personalize our approach and also personalize it to your organization, culture, employee demographics, risk score, and objectives. We want to start simply and introduce new resources as needed based on the individual, their comorbidities, and what they want to accomplish. They will need all of these things at some point in their weight loss journey to meet with long-term success. Our fifth strategy is to line up reliable long-term support. Everyone needs support, but on different levels, and it varies based on the weight loss stage or health improvement level an individual is at. As employers, we need to recognize that change is hard. We need to be sensitive to understanding what employees need and what they're saying about what works for them and what doesn't. And we need to give them the ability to see changes in their risk scores with more than yearly assessments when possible. Follow-up is key in every instant. What also makes a difference is recognizing that making change is hard. Connecting to employees while respecting their privacy is considerate. Knowing what employees are thinking and concerned about. These are real questions employees ask frequently. Can I make time for myself? What's really important to me personally? How much do I need to do to make a difference? Is this going to take long? What difference can I expect to see in areas of my life that are important to me? And is the sacrifice worth it? What we really need to do is reinforce that small changes add up to big results. This is my favorite slide. I'm so proud of our members and their ability to step up and share their personal stories and journeys so that they can help others. It's important for us to know how and why employees are meeting with success. We interview many members, we write their success stories, and I collected what they all have in common. All employees will start out by saying what they didn't want to do, what they don't want to do first. At some point, they have an aha moment. 100% of them have gotten support in one way or another. And at some point, they track or measure along their own personal journeys. But what's very interesting about this, they usually don't start tracking initially. It usually takes that support, some success, and then they get on the bandwagon with tracking. Their journeys are ongoing. They all want to give back and share their story. And the other thing is they all indicate that people treat them better after making positive health and life changes. And they don't want to go back to where they were. So we haven't discussed engaging employees with incentives, but just to give you some food for thought in thinking about your own incentive strategy and current plans, have you considered whether employees are more impacted by winning or losing? Here's an interesting study that put obese participants on a 13-week walking challenge and gave them incentives for hitting their daily goal of 7,000 steps a day. The first group received their incentive if they hit their goal each day. The second group was in a lottery for reaching their goal the day before. The third group was given all of the money up front, and if they didn't reach their daily goal, the money was taken away from them. And the group 4 was the control group. They didn't get money, but they did get feedback. So think about which group was the most successful. If you guess group 3, you're right. Overwhelmingly, the group that was threatened with the money to be taken away hit their goal more often. So the moral of the story is people tend to be more affected by losing, and they also need skin in the game. This might be something you may want to consider when planning out your strategy if you don't look at things in this light to date. So health and population health is clearly all about balance. Employers want productivity, performance, and returns, and employees want to feel autonomous, have mastery and purpose. So what do we need to do to ensure balance with this seesaw? We need leadership, commitment, and support. So we need to walk in the shoes of leadership, or if we are leadership, walk in the shoes of our employees and look at the two in tandem. We need a strong culture of health. We need a culture that also encourages the ability to ask for help. We need good ongoing communication, the ability to be heard so people can share what works and what doesn't. We need to use data effectively, and we need to uncover the data that we're not seeing because it's there. So we need to do that by keeping the data current, look at history, look at it forward in order to drive the most relevant interventions possible. And lastly, don't ever give up on your employees and their ability to improve their health. And finally, what are you doing to encourage employees with communication? Is your communication interesting and relevant, ongoing and current? Does it inspire and make sense? It's easy to have a lot of communication that never sends the right message or reaches your intended audience. In addition to newsletters and webinars for members, we like to send out brief, fun health tips on a wide variety of topics and also customize them based on our clients' look and feel, demographics. So get feedback on your communications so you can make them more effective, especially when you want and need employees to take action on it. So I'm really happy that you all attended today, and I'm even happier that we were able to end early for you. Chris and I'd like to thank you for your attendance. We covered a lot of information, and we welcome the opportunity to discuss your needs and challenges as a result. And we'd love to have you join us again on future webinars. There's a handout you can download attached to this webinar to give you a little more information about our Go Beyond Wellness strategy, data, and services. We'll also be following up with you to send each of you a SHRM certification of course completion for your professional development credit. So thank you for your time, and we hope you all have a wonderful rest of the day. Thank you. Goodbye.